In September, Minister of Public Health Valdo Lawrence revealed that a total of 8,200 persons in Guyana are infected with the human immunodeficiency virus HIV. Of that number, 93% know their status, 73% are on treatment, and 81% are virally suppressed, so they are prevented from transferring the infection. At the observation of World AIDS Day 2019 at the CARICOM Secretariat, Deputy Program Manager of the National AIDS Program Secretariat, Dr. Nicolette Tamayo Jimenez, urged the Guyanese to be cognizant of their responsibility to get tested, know their status, and to cease discriminatory acts against persons living with or affected by the virus. She reminded that the stigma and discrimination are areas that still require much attention.
You have a right to good health, and you have a right to know about all aspects of your well-being, including your HIV status. And there is no reason that you shouldn't know. There is no reason you should be guessing. We have 50 active testing sites across Guyana that you can walk in and ask to get a test done. And at this point, I believe that every adult who is accessing sexual reproductive services should also access HIV testing services.
World AIDS Day 2019 is being held under the theme, Communities Make the Difference. Director of PANCAP, Derek Springer, stated that the theme allows tribute to be paid to the passion, advocacy, resourcefulness, and relevance communities have made to the HIV response at the international, national, and local levels. He reflected on his tenure as a counselor during the AIDS epidemic, where he witnessed the loss of lives of persons who were infected by the disease. Springer reflected on the significant strides persons at the community level have made and continue to make to contribute to the AIDS response in many different ways.
The group that really stepped up were women. Women shouldered the responsibility as caregivers. Women took time off from their workplaces to attend to their loved ones. They stepped up. And so we began to see a movement, an unprecedented movement in the response to, of course, a disease that challenged us and challenged our very humanity.
Reminiscing on the advent of the HIV pandemic more than 3 decades ago, Springer also made mention of the small community of doctors who made a difference at a time where many of the medical practitioners rejected persons living with the disease. Springer told those in attendance of a story of one of his patients that has resonated with him over the years in the hope that it would provide inspiration to those currently battling the disease.
Philip van der Heijden was diagnosed with HIV on the 7th of April, 1994. That was a very important day for him because it was his birthday. But he was also diagnosed with AIDS. And the doctor at the time said he had approximately a week to live. But Philip van der Heijden demonstrated to us that he had that indomitable will to live, because he had tremendous support, the support of his family, the support of his neighbors, the support of his wider community, and the support of the health fraternity. And so Philip van der Heijden eventually lost his battle to AIDS on Monday the 19th of January, 2008.
He urged persons to respond with compassion, care, and love in their hearts for persons living with HIV or AIDS. World AIDS Day will be observed on Sunday, the 1st of December. This year will mark the 31st observance worldwide. I'm Mel Griffith, reporting for HGP Nightly News.